for future purpose? Thank you.
Yes, we are recording the session. Yeah.
Okay, thank you very much. Yeah, so that it will be useful for future purposes.
Yeah, just in case if any guest speaker doesn't want to be recorded, please let me know in private chat. I won't be recording that particular session. Yeah, thank you.
Thank you, Vikaj. I just wanted to say a few lines before I hand over to Ajit ji, that this is a kind of ये थोड़ा नया topic है. I will be switching between little bit of Hindi and English. थोड़ा बहुत मैं हिंदी भी बोलूँगा, English भी बोलूँगा. क्षमा कीजिए उसके लिए, ताकि speakers को भी अच्छा से पता चले कि हम क्या बोल रहे हैं, क्या बात कर रहे हैं. ग्रीफ एंड बेरीमेंट, मैं भी एक्चुअली आज मौका मिला था कि हिंदी में इसका खोजने का, और कंफ्यूजन कुछ भी है क्योंकि एक दो लोग एक्चुअली फोन करके बोले थे कि आखिर ये टॉपिक क्या है शेखर जी, विच वाज गुड, मींस दे आर आल्सो सर्च कर रहे हैं. तो ये जो शोक है, खेद है, और जो व्यथा जो बोलते हैं ग्रीफ के बारे में, और बेरीमेंट जो है मोर और लेस वो एक ही हाथ से जाता है, हैंड इन हैंड. लेकिन खासकर जो बेरीमेंट है, जो वियोग के बारे में बात करते हैं हम, या शोक दशा के बारे में करते हैं, या मृत्यु की कारण की क्षति से जो हो जाता है, तो उनका वो बेरीमेंट है. तो एक बार मैं आपको जस्ट गिविंग यू ब्रीफ what could it means grief and bereavement जो इंग्लिश में है, what is the meaning हिंदी में क्या है. इसको लॉस भी बोलते हैं, खासकर जब डॉक्टर कुलकर्णी बात करेगी तो वर्ड लॉस शायद यूज करे, तो आप कंफ्यूज नहीं मत हो जाइए. जो भी क्षति है, नुकसान है, हानि है, वो भी एक ग्रीफ बेरीमेंट का भी एक पार्ट एंड पार्सल ऑफ लॉस है. तो मैं एक विचार आपके साथ रखते हुए मैं अजीत जी को हैंड ओवर करता हूँ कि ये जो कोरोना टाइम्स है, कोविड टाइम्स है, जो डेथ एंड डाइंग का है, एक चीज मेरे को पर्सनली, भगवान से कृपा से ऐसा हादसा अभी तक नहीं हुआ है परिवार में, लेकिन जो लोग गूंजे हैं उसे, कि हमारा एक चीज बार बार हमको बहुत तकलीफ देने का ये बात है. वन थिंग रियली पेन्स मी लॉट. In our culture, whatever the religious background we come from in India especially, maybe it is same in international, ये जो human touch जो होता है, जो हम last recites जब perform करते हैं culturally, वो touch भी नहीं होने का जो दर्द है, I think that is the most painful for us all, that we are not able to give a final respectful departure for our loved ones from this planet. वो जो दर्द है, शायद वो दर्द से बहुत सारे लोग जूझ रहे हैं, और वही एक चीज है, बहुत सारा चीज है हमको इस मुद्दा पे बात करने का प्रेरित किया है. और एक ऐसा मंच मिला है कि कोविड वॉलंटियर्स के रूप में, कि नया टॉपिक होने के बावजूद भी उन्होंने इतना अच्छा से इनको रेसिप्रोट किया है और बोर्ड पे लिया है कि यस, आई मीन दिस इज अ टाइम वी शुड एक्चुअली स्टार्ट टॉकिंग अबाउट दिस. तो वो जो दर्द है हमको पीछे से कहीं ना कहीं प्रेरित किया है, तो वो सामने रखते हुए, और कितने परिवार आज, there are scores of families actually who are going through these difficult times. ये जो डेथ जो है, डाइंग जो है, it's हमारा चेहरा पे, it's in our face. You can't actually, almost हर घर के शायद सामने आके खड़ा हुआ है, एक तरह से एक डर पैदा हुआ है. So this is the time I think we should talk about this. Therefore, मैं अभी अजीत जी को एक अनुरोध करता हूँ कि अजीत जी जो है नेशनल हेल्थ सिस्टम्स रिसोर्स सेंटर से हैं, बहुत वर्षों का उनका एक्सपीरियंस है हेल्थ में, और जो मेंटल हेल्थ है एन इंटीग्रल पार्ट एज ए हेल्थ में है, वो मिनिस्ट्री ऑफ हेल्थ से जुड़े हुए हैं, खासकर बिहार से. So he will be able to give a very kind of contextualized especially this topic today. So I herewith hand over to Ajit ji. Ajit ji, thank you.
Thank you very much, Shekhar ji, and thank you for this opportunity, and thanks to Gracie for you are accepted this invitation to speak. After a long time, I am seeing you, and I'm really happy. I've respected Vijay Prakash sir. You are here to just guide us how to, because the previous presentation we have discussed a lot how to prepare ourselves for our family for the after the death, how our family will going to survive it, and preparation for the grief is basically ये जो topic है. I'm just also trying to speak mixed Hindi and English both. So basically, this topic is closely related with the mental health issue. Gracie is doing here behalf of the Cornerstone Positive Psychology. She is one of the pioneer in this country, or you can say in the world. And now this is very important. I want to share my experience. When my maternal uncle was ill, and the first time in All India Institute of Medical Sciences in New Delhi, I just observed a counselor who is doing counseling after the death of the family member. So the first time I just come to know, oh my God, this is a kind of profession. And after that, मैंने उसके बाद जो देखा कि जिस तरीके से जिस प्रोफेशनली वो ओरिएंट कर रहे थे, लोग काउंसिल कर रहे थे फैमिली मेंबर को, it was really a very, the kind of enlightenment what I feel that day. कि लोग इस तरीके से भी हॉस्पिटल में काम करते हैं, because our experience in the state like Bihar or other country in public health facilities, we all people are having the mortuary, we all are having the all the legal provisions. I want to just express the initiative taken by the government of India. In the 2017, the government of India has passed in Mental Health Care Act in 2017. It's very important act, which is actually you can say that directly this discriminating the attempt of suicide, which was punishable under the section 309 of IPC. Now the whole scenario of mental health has been changed. Now this is a kind of the right, and the law was described in the opening paragraph. I want to read it. An act to provide for the mental health care and service for the person with mental illness, and to protect, promote, and fulfill the right of such person during the delivery of mental health care and services. Means ये जो पूरा मेंटल हेल्थ केयर का फ्रेम है आफ्टर दिस एक्ट, अब ये उस व्यक्ति के राइट के प्रोस्पेक्टिव में देखा जा रहा है. मतलब क्या है कि अब यदि ग्रीफ है, ग्रीफ एक एंट्री पॉइंट है, इसमें यदि स्ट्रेस में है कोई भी व्यक्ति, तो वो सरकार की अब जवाबदेही है. दिस इज द नाउ द ऑब्लिगेशन ऑफ द स्टेट to provide support and service to the mental health problem, those suffering from mental health issues. So in brief, again I want to welcome, and of course primarily I want to thanks the Sekhar ji and Dr. Vikas and all the dignitaries, those who are present in this meeting, or you can say the webinar, कि आप इस इम्पोर्टेंट इशू को, जो कि अभी कोविड के समय बहुत ज्यादा पर्टिनेंट, और यदि कोविड के समय इस तरीके का स्ट्रेस पूरा फैमिली झेल रहा है, जिसको कि दे आर फेसिंग एक्चुअली द प्रॉब्लम एंड इश्यूज, द स्टेट इज बाय दिस एक्ट दे आर बाउंड टू प्रोवाइड द सपोर्ट ऑफ दिस फैमिली और द पर्सन. सो इन दिस लाइन, इन दिस स्टेटमेंट एंड दिस constitutional obligation, act is being made, and thank you for this opportunity, and I want to just welcome all the people कि please guide us or guide to a state कि how to develop a system, how to develop a structure, how to develop a personals, and how to develop a support structure to this kind of people in the state like Bihar, where we can develop a kind of model with the support of Cornerstone and other institution that would be replicated across the country. Thank you very much for this wonderful opportunity provided by you. Thank you.
Thanks, बहुत धन्यवाद अदित जी. May I welcome Vijay Prakash sir to give us a keynote speaking, and then we will come on to the speakers thereafter. Thank you.
बहुत बहुत धन्यवाद शेखर जी. Thanks a lot, Dr. Trier, Gracie ji, Kulkarni ji, and all the participants here. I suppose I am audible.
Yes,
so,
sir.
Today's on behalf of Bihar Vidyapeeth, I extend a warm welcome to all of you. The Bihar Vidyapeeth is an old organization established by Gandhi ji and Dr. Rajendra Prasad, who later became President of India. He, in fact, breathed his last in this campus only. And we have been associated with this kind of relief works right from, we have a history of about 100 years, and we have been associated in almost all calamities that that Bihar has seen. Maybe it's an earthquake or flood or drought. Everywhere we have been, and this COVID times we are has come out with new challenges, and one of the major challenges that you have highlighted, this has somehow not been debated so far, not been discussed, is the management of grief and bereavement. Both, management, how to manage the grief that is coming up, and bereavement has obviously has given a new dimension to the whole issue. अब सबसे बड़ी समस्या ये है कि जब किसी का डेथ हो रहा है, और हॉस्पिटल में हम लोग तो अभी तक नॉर्मली डिस्कस करते आ रहे हैं कैसे कोरोना टाइम से बचें, लेकिन जिसका डेथ हो गया और डेथ के चलते जो फैमिली में प्रॉब्लम्स हो रहे हैं, सोसाइटी में प्रॉब्लम्स हो रहे हैं और होने वाले हैं, ये दोनों बहुत ही एक नया डायमेंशन सोसाइटी में, सोसाइटल नया चैलेंजेस ला रहा है. बहुत बार ऐसा अभी देखने को मिल रहा है कि पूरा का पूरा फैमिली का डेथ हो गया, मतलब फादर मदर दोनों का डेथ हो गया, बहुत सारे लोग ऑर्फन हो गए, बहुत से लोग विडो हो गए हैं, ब्रेड अर्नर्स घर के चले गए. इनफैक्ट इतना भी पैसा नहीं है लोगों को. एक तरफ तो अभी जैसा कि शेखर जी ने बताया कि एक समस्या ये है कि लोग इवन क्रिमेशन ग्राउंड तक नहीं जा पा रहे हैं, और जाने से तो घबरा रहे हैं वो अलग, लेकिन एक जो दर्द उसके चलते है कि हम क्रिमेशन ग्राउंड में नहीं गए, हम उसके फंक्शंस में नहीं जा रहे हैं, हम लोग फंक्शंस भी नहीं हो पा रहा है. तो ये एक तो इसका दो दर्द है, बहुत दिनों तक ये रहता है. मुझे याद है मेरे फादर का जब डेथ हुआ था आज से 1996 में, तो 3 महीने मुझे लगे थे अपनी माँ को काउंसिल करने में, और इसके लिए हम लोगों ने गीता पढ़ना शुरू किया था. 3 महीने तक हम लोगों ने गीता का पाठ किया था मैंने, और एक्सप्लेन किया था गीता में क्या है जिसको हम लोग सीख सकते हैं टू मैनेज आवरसेल्फ. तो ये जो ग्रीफ और इसका मैनेजमेंट है, जो शॉक फैमिली को लगने वाला है, वो एक साइकोलॉजिकल मैनेजमेंट, यह एक बहुत बड़ी चुनौती है जिस पर हम लोग को विचार करना चाहिए. और अभी अजीत जी ने जो बताया कि गवर्नमेंट ऑफ इंडिया का जो एक्ट आया है, उसके तहत क्या क्या कार्रवाई हो सकती है, उसकी चर्चा शायद आप लोग करेंगे. मैं कुछ और बातों की ओर भी मैं चाहता हूं कि हम लोग आज ध्यान दें. कुछ बातें तो बहुत महत्वपूर्ण हैं, जैसे बहुत से लोग को अभी ये पता नहीं है कि उनकी प्रॉपर्टी का क्या, अनसर्टेनिटी के एक माहौल में बहुत सारे परिवार, बहुत सारे लोग आ गए हैं, जिसका ब्रेड अर्नर चला गया, जिसका जो आदमी उसका बैंक अकाउंट मैनेज करता था वो चला गया. अब उन लोगों को डर हो रहा है कि बैंक में हमको पैसा मिलेगा नहीं मिलेगा. बहुत सारी बातें उसने बताई थी, नहीं बताई थी. जो डॉक्यूमेंट्स जो उसके पास है, जो उसका जेन्युइन पैसा भी है, वो भी कैसे रियलाइज होगा यह भी घर के लोगों को मालूम नहीं है। मैं तो देखा हूं, मतलब इस तरह की सैकड़ों कहानियां हैं कि कैसे लोग लोग एकदम एकदम एक कंडीशन ऑफ अनसर्टेनिटी में आ गए हैं। ये जो चैलेंज ऑफ अनसर्टेनिटी है, ये बहुत ज्यादा ग्रीफ और शॉक के स्टेज में लोग हैं। कैसे इसको मैनेज किया जाएगा? तो मुझे लगता है कि शायद एक कैंपेन हमें चलाने की जरूरत है कि हम ये बताएं कि कैसे आप, अब जैसे सिंपल चीज है, बैंक का अकाउंट नंबर लोगों को मालूम नहीं है, पेपर्स भी घर में नहीं है। जो जो ये कार्ड मिला है, एटीएम कार्ड मिला हुआ है, एटीएम कार्ड को भी का पासवर्ड लोग नहीं जानते हैं, और जितना भी प्रॉपर्टी है, प्रॉपर्टी का डॉक्यूमेंट्स कहां पर है ये भी नहीं मालूम है। तो अब इनफैक्ट कई मुझे लगता है एनजीओ को और सरकार को भी इस चीज पर काम करने की जरूरत होगी कि कैसे हम इन फैमिलीज को उनके जो जो वाजिब हक है, ये वाजिब हक ये एम्प्लॉयमेंट के से रिलेटेड हो सकता है, जो कि हो सकता है कि उसको जो सरकार से या जो जिस संस्था में काम कर रहे हैं वहां से जो उनको देय राशि है उसको दिलाने में, या फिर जो उनकी अपनी प्रॉपर्टी है, उनका अपना जो पैसा है बैंक्स में, वो भी दिलाना एक कठिन काम है। बताना बहुत सारे स्कीम्स हैं सरकार के, ऑलरेडी स्कीम्स हैं। बिहार सरकार के मैं सिर्फ एक दो तीन का लिस्ट कर दूं। बिहार सरकार में परवरिश योजना है, या उनके स्पॉन्सरशिप या फोस्टरशिप के लिए योजनाएं हैं बिहार सरकार का, और या इसमें देखिएगा प्रधानमंत्री जीवन ज्योति योजना है, जो जिसमें कि बीमा होता है, जो सभी जो भी जो सेविंग्स बैंक अकाउंट होल्डर्स हैं और वो अगर कुछ पैसा जमा करते हैं रेगुलरली तो उनका एक बीमा होता है। मैं समझता हूँ उस बीमा का फायदा उठा सकते हैं लोग। अभी अभी बहुत लोगों को ये समस्या हो रही है कि हम बच्चियों का कैसे ये करें, बच्चियों का परवरिश कैसे करेंगे, या लड़कियों का जो बच्चे स्कूल कॉलेजेस में हैं उनका फीस कैसे भरा जाएगा। ये सब इतने चैलेंजेस हैं। मैं समझता हूँ इस पर भी बहुत सारी संस्थाओं ने काम करना शुरू किया है, जो कि जहां पर कि हम लोग बच्चों को भेज सकते हैं, उनके एजुकेशनल सपोर्ट के लिए भेज सकते हैं, या गवर्नमेंट की स्कीम्स हैं। कन्या सुरक्षा योजना थी एक, जो कि लड़कियों के लिए थी, और उसके अंतर्गत कुछ राशि है जो कि उपलब्ध हो सकता है, या कन्या विवाह योजना है जो शादी के लिए हो सकता है। तो जो सरकार की योजनाएं हैं उसको कैसे हम एक्सेस करवाएं, यह भी हमारा एक काम होना चाहिए। और दूसरा काम होना चाहिए कि हमको ये जो साइकोलॉजिकल, कैसे हम साइकोलॉजिकल लोगों को सपोर्ट दें, परिवार वालों को सपोर्ट दें, घर के लोगों को सपोर्ट दें। और सबसे सॉरी सबसे महत्वपूर्ण ये है कि हम लोग ये देखें कि जो लोग ब्रेड अर्नर चला गया है, अब नया ब्रेड अर्नर परिवार में कैसे आएगा। यह एक बहुत बड़ी चुनौती हम लोगों के लिए होगी कि हम लोग अगर बेरीवमेंट को मैनेज करना चाहते हैं, या हम लोग ग्रीफ को मैनेज करना चाहते हैं, तो क्योंकि मैं आपको सिर्फ एक बात बता दूं, मेरा अनुभव रहा है, मैं सोशल वेलफेयर में बहुत दिनों तक काम किया हूं, मेरा अनुभव ये रहा है कि जब भी इस तरह की ट्रेजेडी आती है, कैलेमिटी आती है, तो सडनली आप देखेंगे पलायन बढ़ जाता है, ट्रैफिकिंग बढ़ जाती है, और इस तरह के जो मैं समझता हूँ कैलेमिटी से जुड़ा हुआ जो सोशल इम्पैक्ट है वो सोसाइटी पर आता है। तो वी हैव टू बी केयरफुल कि कैसे हम लोग कितनी आसानी से हम लोग इसको ये कर पाए। अभी 2-2, 4-4 वर्ष के बच्चे, मतलब मुझे तो दुख होता है, मतलब मेरा रोया कांप जाता है जब मैं ये कहता हूँ। ऐसे लोगों का डेथ हो गया है कि पेरेंट्स का दोनों का डेथ हो गया है, और छोटे बच्चे 3 साल और 4 साल के 5 साल के बच्चे भी हैं जिनके पूरा लाइफ है और देयर इज नोबडी टू लुक फॉरवर्ड टू। तो उनके लिए ब्रेड की बात, तो एम्प्लॉयमेंट की बात परिवार में करना ये एक तो जरूरी है ही। साथ साथ जो मैंने कहा कि उनकी प्रॉपर्टी को मैनेज करना। यहाँ तक कि देखिए क्या समस्या है, यहाँ पर समस्या ये भी है कि हॉस्पिटल से घर तक ले जाने वाला कोई नहीं। यहाँ समस्या ये भी है कि वहां पर जलाने के लिए पैसा भी नहीं है लोगों को, बहुत लोगों के पास। तो इसके लिए भी सरकार के पास पैसा है, लेकिन वो एक्सेस कैसे होगा। कबीर अंत्येष्टि योजना है एक, जिसमें कि लोग लास्ट राइट्स के लिए पैसा देते हैं। तो मैं समझता हूँ इस सब का हम लोगों को हम जो सिविल सोसाइटी है उसको आगे आना होगा। सरकार ने अभी एक स्कीम बनाई है जिसमें कि कोविड विक्टिम्स को, कोविड में जो इनका डेथ हो जा रहा है, उनको 4 लाख रुपया बिहार गवर्नमेंट दे रही है। तो ये भी देखने की जरूरत है कि ये जो 4 लाख रुपया है ये भी अवेलेबल हो जाए। और ये इसके लिए जो भी प्रक्रिया है वो करा दिया जाए। तो एक बहुत बड़ी चुनौती सरकार पर भी है, कैसे मैनेज करें, और दूसरी तरफ जो सिविल सोसाइटी है उस पर एक बहुत बड़ा उत्तरदायित्व आ गया है कि वो इस क्राइसिस को मैनेज करे इस एंगल से। जो एंगल अभी वो मैं बधाई देता हूँ शेखर जी को और जो जो जिन लोगों ने आज किया है विकास और सब लोग मिल करके जो इस विषय को चुना है, यह एक बहुत बड़ा विषय है जिसको भी काफी दिनों तक चलाने की जरूरत होगी ताकि हम इनको इनको एक रिलीफ दे सकें और समाज में एक ऑर्डर रख सकें। मैं बहुत बहुत शुभकामनाएं देता हूं और बिहार विद्यापीठ की ओर से सभी लोगों को यह आश्वस्त करता हूं कि हम लोग इस चीज के लिए हमेशा सचेष्ट रहेंगे और प्रयास करेंगे कि ये जो ग्रीफ और बेरीफमेंट का ये फेज है वो लंबा चलने वाला है, इसको कैसे हम लोग मैनेज करें, इसमें हम लोग काम करते रहें। बहुत बहुत धन्यवाद सबों का, और आशा करता हूं कि आज का जो ये डायलॉग होगा यह हम लोग के लिए एक गाइडेंस देगा कि हम क्या करते हैं। बहुत बहुत धन्यवाद।
बहुत बहुत धन्यवाद विजय प्रकाश जी सर। और आपने इट्स नॉट ओनली द ग्रीफ और बेरीमेंट का, इट्स बियॉन्ड जस्ट काइंड ऑफ ग्रीफ एंड बेरीमेंट, खासकर जो चिल्ड्रन डेस्टिट्यूट्स इन कोविड टाइम्स जो आपने सब्जेक्ट मुद्दा उठाया था, बहुत आई मीन वैलिड है। सो वंस अगेन थैंक यू। और आई वुड लाइक टू हियर विद ऑन बिहाफ ऑफ द होल फोरम, वुड लाइक टू वेलकम Dr. Troyer. I know, Doctor, you simply wanted to be known as John. So either way, from India, it's more of it's a lot of respect. So you must heard by this time that we call Madam Sir. So I think I will continuously will say Dr. Troyer. ऐसे ही डॉक्टर ट्रॉयर के बारे में छोटा सा इंट्रोडक्शन है कि जिसे हम भागते हैं, from which we all run away, Dr. Troyer always talks about that, which is a death and dying. And he has actually been granted such a decent grant, United Kingdom Research and Innovation Grant. It's not an easy to get such kind of grant for his work, but coming from America, I've been working, teaching, researching in the University of Bath in the UK. We are very privileged, and I must say, thank you, really thank you. I know you may be still, I don't know what is your body is operating. आपका US का time चल रहा है body का, or UK time, because you just landed in the UK this week. So it's such an honor, and thanks for accepting in such a short notice, Dr. Troyer. And once again, I know you are embracing the multilingual, but we are sorry in case we are making you a bit uncomfortable. And yeah, please carry on with your presentation and give us shed some light on this topic which you gathered by this time, that it's hardly, the awareness or knowledge is not much around, as we discussed in the past as well. So please go ahead, and once again, welcome.
Sure. No, thank you. Thank you, Shekhar. Thank you, everyone. It's a great honor, honestly, for me to be able to speak with all of you, everyone, globally, but particularly with colleagues in India. I am sincere when I say I'm embarrassed because I don't speak Hindi, and I should be speaking in the language that most of you are communicating, out of respect, for the work you all do. And in the West, of which I am, a Westerner, and certainly from the first world in the West, no question about that. We just expect everyone to speak English, and I'm really aware of this because I do a lot of work in China as well, and it's very common in China for everyone to just, because I'm the only English speaker there, to try and speak in English. So thank you for accommodating this. Let me know if there are any questions about what I'm saying. But again, I very much appreciate the opportunity to speak with you all. Shekhar also mentioned that I did just fly back from America, where I'm originally from, on what day is it today? Saturday? I don't even know what day it is. A couple of days ago. So I am I am a little jet lagged still from coming back from being in America. And I just want to mention America briefly, and then I'll actually go into my talk, and I will stay to time because I realize it is late for you all there. It's afternoon for me here. But that, you know, I was in America accidentally, honestly, for 5 months, living with my parents, in part because of COVID travel restrictions. So I went to see my parents in December for Christmas holidays. And then the borders, basically all the flights got canceled. And so I ended up living with my parents again. This happened last year for a time, but again for 5 months until the flights finally came back. And so I was finally able to fly back. And, you know, Shekhar knows some of this, but my parents have had some real health challenges lately. My mom in particular has different forms of cancer and is receiving treatment and care, and they're as healthy, I think, as they can be. But one of the ironies for me personally during this pandemic has meant that I've now spent much more time with my parents than I would have otherwise. And I think about this a lot because I know that there are so many people who can't do that because their parents or their loved ones died. And I think about that perhaps more than I should, but it is one of those things I think about quite a bit because I realize in ways that we're only now, I think, beginning to understand, the pandemic has really impacted different people in different nations very differently, which is perhaps a broad generalization, but I think it's correct that it has not been universal. It has not been equal, and that the West now faces, I think, a real issue with just assuming they can move on, because somehow we've seen what is a very successful use of vaccines as well as other programs, but let's stick with vaccinations. And that the first world in the West is ready to say, we're done, let's go. And that is not the case. That is not the case. And when I was thinking about what to talk about tonight, what I wanted to talk about a little bit was some of the research I've done around the AIDS epidemic in the West, but the AIDS epidemic, understanding the AIDS epidemic during the coronavirus pandemic. So what happens when you have an AIDS pandemic, which is still happening, during an overlapping pandemic, but the AIDS epidemic is the one that has largely kind of been forgotten about, certainly in the West, and has been overshadowed, but what can we learn from it? And so I do have a few images, so you don't have to stare at my face talking for on Zoom like this. And I will, so I do want to show a couple things here. I won't go through all of this, don't worry. You don't have to worry about seeing all of this going like this. Let me just do it this way. And so one of the things I was thinking about talking about was just what is AIDS in the age of COVID-19? And what can we learn from it? And this is a kind of talk I've been giving in different places, but I kind of tooled it for tonight. And so I'll just quickly go through this. And also, I'm sorry, just say that, so the Center for Death in Society, or CDAS, which Shekhar has mentioned and is familiar with, we are an interdisciplinary studies center at the University of Bath, and we study death, dying, and bereavement. That's what we study. That's what we work on. So interdisciplinary studies related to all these topics work increasingly globally. So with colleagues, for example, in China, but also now South Asia, across Europe, across America. So we do work all over the place. And also one of the reasons I want to accept this invitation was one of our former colleagues, Shahid Pervez, who was working in India he did a postdoc with our Center for Development Studies and then the Center for Death and Society. Both, he worked in development in rural areas, particularly around maternal and infant mortality, so women and children mortality in India. He just died of COVID. He was 44, young children, and all of us were quite shocked, one, that he had died, but two, as I think everyone who knows anyone in, across India broadly defined, is just know people who have died. And it was very sad for all of us because Shahid was just an amazing researcher. He was working with the MCRIL group, consulting group in India at this point. And we just yesterday had the Zoom funeral service for him from colleagues all around the world. And so I thought it was important to show some respect for him as well, for the work he had done. And hopefully I can, raise a couple points, myself tonight, but he was truly the expert that way. So Shahid mentioned I'm from the States originally. I'm from the state of Wisconsin. This is not important, but I showed a map. So Wisconsin is right here. The state was called home. This is from obituary announcements. What is the most common way people say someone has died? It was sort of a data project, but I'm from the northern part of the States, but I've been in England for 12 years. Oh, that's my book. Forget about that. Sorry. You don't see my book. So one of the things I was interested in was how AIDS as an epidemic, which is still with us, AIDS is still with us, how it impacted how funerals happened in America and the West, and how AIDS changed concepts of grief and bereavement. And what I did was I worked a lot with funeral directors in America around the question of AIDS. And this was one of the key resources, which was a publication for funeral directors called The Director. And of course, AIDS is still it's still a phenomenon. December 1st is still World AIDS Day. I'm old enough to remember when World AIDS Day was first started back in the 1990s. It still happens every day, but it doesn't have the same, not in the West. Different parts of the world, you still find a lot of events around it, but certainly in the West, in the first world, it is largely something that even a lot of people don't know about. Unless, of course, you've been impacted by it or work in public health, it's still something that is not, it's been forgotten about. And I think that's one of the things I'm interested in. So what does it say about death today? And I'll go through this quickly. So I think in the West, a lot of the West in the first world, American, Anglo, so American, British, but also a lot of European discourse and thinking around death and dying really begins around the idea of, in the 1970s, so in the 1970s, post-World War II, this idea of trying to defeat disease. So this was Richard Nixon signing the War on Cancer initiative. We're still fighting the war on cancer, but that there's this idea that there's now suddenly a move against death to try and cure disease that had not previously been cured, and which I will be honest, I support. I think there's a lot of diseases, concepts around disease that can be cured, should be taken care of, and that what happens in the 1970s then is a further kind of understanding. And this is another US government report that has a big impact. Suddenly we're starting to change the definition of death. So when do we define death? And a lot of that is impacted by life support machinery, organ transplantation, a lot of different techniques that make death something that is not as concrete, particularly in the West, where suddenly now we can think about death as being not an instantaneous moment, but more drawn out. And that is a point of struggle for many people in the West. One good book I think that came out in the 70s is Lynn Laughlin's book, The Craft of Dying, The Modern Face of Death, in 1978. Lynn Laughlin at that time was a young sociologist. She's now retired, was in California. And this is a really good book where I think she surveys what is going on in terms of death and dying in the West, particularly in America. at that time. And it's around MIT Press reissued it. It's a good book to read, I think. And I think she talks about a lot of things. That is a photo of the reissue. I did write a new introduction to it, I should say, full disclosure. But that's it. But her book is, I think it's very good on its own. And what she describes in the West is the emergence of a kind of what she calls a happy death movement, where death becomes this point of celebration, something to embrace in the 1970s. And so grief and bereavement suddenly take up a new become part of a new movement to try and embrace death. And I'm moving quickly here, but I think that grief and bereavement in part begin to shape different kinds of death movements in America. So there's this real push for people to be aware about death, to accept death, all of which are still with us today. But also then the creation of places like hospices, and the idea of a space in which people can go to die, or they die in their home, as opposed to dying to a hospital. And so we begin to see the emergence of sort of a lot of death discussions we have today in these ideas of how can we make the death of a person, but then also the grief, the bereavement, the family's experience, how can we make that a more positive experience, which is one way of trying to qualify it. So there's a lot of talking about death, and then encouragement to talk about death, which continues today. So I think one of the things you can ask is, so what happened? What happened to all the 1970s movements? A lot of this has kind of been forgotten about the States. And I think, again, it comes back to a lot of the AIDS impact. And this is where we begin to see the impact of disease. So this is the HIV virus. That is the coronavirus. These are artistic representations of them. And I think one of the things that comes out of AIDS that all of us watching the COVID pandemic I should be aware of is there was eventually a lot of protests. And I think protests around the AIDS epidemic is something that largely came from the LGBTQ or gay and lesbian communities, particularly the gay community, but with a lot of active support across broad LGBTQ communities. And I think that, this is really good, very good French film, which was a dramatization of it. It's available online if you want to watch it, but it's a very good French film that looked at the French ACT UP movement. And there was a real resistance to, and this is Larry Kramer, who's a very famous American activist around it. There was a real resistance to just sort of accepting the status quo with how AIDS was being described. And so as part of the grief over the AIDS epidemic, activism became very much an important part of it. Then you enter into the medical community. And so this is Tony Fauci, Dr. Anthony Fauci. Many of you will have seen him on television in America. And he would often argue and spar with Larry Kramer, pardon me. The two of them had many famous arguments about how to best help or treat people with AIDS. You then find individuals in the UK. This is Donald Acheson. He designed the AIDS public health campaign, which was controversial in its time in the UK. And the idea was you want to raise public education around it. You want to bring things to it. But there was still this resistance to the fact that not enough was being done. And so what you find is activist movements trying to draw attention to AIDS deaths by, for example, having die-ins where everyone is on the streets in an act of civil disobedience, trying to die in. But then you also have memorialization. And so this is a large quilt project called the AIDS Quilt, in which individuals were memorialized in cloth pieces about the size of a standard grave that were then put on display. This is in Washington, D.C. on the Central Mall area that stretched all the way across. This is a close-up of what they look like. They're each, again, about the size of a grave. That's an aerial view of a one section. That's a more recent exhibition of it. It was in New York on Governor's Island. And so I come back to this question, like, so what happens now with with COVID, and I think grief and bereavement is the way we're describing it. There are a couple of things I've been thinking about. One is, I think that for all of us who work in death and dying, but public health, anything to do with individuals going through grief and bereavement, there's going to be a long, we're talking about many years here. We're talking about many years to finally begin to see the impact of what's going to happen. And I think that is understood, but that's going to have to be, I think, said again and again and again, because the long-term impacts are going to take a long time to show up, both in terms of families, but also in terms of the impact of the death of loved ones. We also are going to have to pay attention to this idea, and this is more in the West, that somehow COVID becomes a disease of only something that impacts the developing world. And that the challenge will be trying to keep COVID from reverting into a kind of almost the way that AIDS has actually taken shape, which is that AIDS becomes something that is only afflicting or isn't treated well enough in the developing or the third world, and the first world tries to forget about it. And I think that will become the political challenge. And we're too close into this right now, but I think that will compound the grief of many families who will say, no, we are still experiencing the impact of this disease, and we need attention, but we also need financial resources. And so this will become a global governance issue. And I don't know how it's going to go. So my final thought on this, and I've talked for too long, and this was something that I actually read in last March, a year ago in 2020. And it was by one of the key writers about the AIDS epidemic, Michael Spector, and he wrote this in the New Yorker magazine. And I have to say, I think that what Spector says here, and I'll read it out loud. He just says, the bigger question is whether we will learn from the fact that this pandemic, meaning COVID, will kill many more people than it had to. I'd like to think we would, but if the past is any guide, this pandemic will end up with a bunch of new commissions and ominous reports. As soon as they are printed, they will be forgotten. And I think the challenge that all of us are facing with this, particularly in a local community perspective, is to make sure that the commissions and reports and everything that's going to come out, that they're not forgotten about, and that there's a whole world now beginning to open up, and we're on the precipice of it, of both in an activist but also community action form, but also just supporting people experiencing grief and bereavement, drawing attention to the fact that this is a very real issue and it has not gone away. And that if anything comes out of the COVID moment we're in, which will be very long, it is perhaps also then better preparedness for future pandemics, because there are many people who have lost loved ones all around the world, but particularly, let's just say India right now, that many of those people died preventable deaths. And that if there's anything that comes out of this, it is my hope that the families, the grieving families, can help drive some of the change in order to prevent that from happening, again in the future. So thank you for your time. And with that, I will stop sharing the screen and hand back control to Shekhar and our colleagues out there. Thank you.
Thank you very much, Dr. Troyer. Actually, I mean the body language. I know you are having jet lag, and it's almost 5-ish in the UK. I don't know what is in Wisconsin, but I think this is what we need to embrace. That when we talk about that scary word, the 5-letter word death, I don't know anybody, or everybody can be that relaxing and have that the smile in their face, when we are talking about that. So I think you have said that, and this is a kind of way forward. This is not the end of it. This is only a start, as we were saying. So I'm sure we can build on that, your experiences, your great knowledge, what you've built from America to the UK and other parts of the world you're working. So once again, thank you. And without losing much time, I would like to hear with welcome Dr. Priyadarshini Kulkarni ma'am. She's a kind of pioneer, like Dr. Troyer, death and dying, or talking about death, and she is the champion of palliative medicine, having done her MBBS and then specialized palliative medicines in the UK, especially from Cardiff University in Wales. Actually, this afternoon I got to know that she actually pretty much made many students. ऐसा उनका कुछ छात्र हैं, students है, very much in All India Institute of Medical Sciences पटना में भी काम करते हैं और वो इधर भी ट्रेनिंग देती है. Thank you, ma'am, for enlightening that the small chat we had this afternoon. इनका खासियत ये है कि इन्होंने प्रियदर्शी मैम ने इंडिया में बहुत सारा फैमिली से she has worked with many families and helped, counseled, and most of our clientele actually are some of the people who have gone through those experiences. And we have been thinking to do some kind of work, joint work, since last COVID times in 2020. And we're very chuffed that at least our communication, our dialogue has reached to a point where we are having this webinar. प्रियदर्शनी का भी थोड़ा सा जी बोल रही थी कि हिंदी इज नॉट टू बैड बट प्रिफरेबली इन इंग्लिश. सो मैं फिर उनके बारे में बताने में भी दोनों भाषा यूज कर रहा हूँ, तो इसके लिए क्षमा चाहता हूँ. So once again, ma'am, thank you very much for coming on board in such a short notice, and would like to hand over to you, and the floor belongs to you. So please go ahead. Thank you.
Thank you, Shekhar, and thanks, Dr. Troyer, and everyone for agreeing to have this important discussion today. Should we directly go to the presentation? Can I share my screen, Shekhar?
Yes, please, ma'am. Yeah, please go ahead. Thank you.
So last year when COVID started, we were actually little bit comfortable initially, thinking that we don't have to go for our routine job. There is no routine. We can do everything from home. And for few days, it was a good change. Then we were forced to become Atmanirbhar because no maids were coming, no support staff was coming, and we had to do everything ourselves. There was some excitement initially, but later on it started to become a little boring. And then there was no meeting friends, no talking, no socializing, so we had to depend on COVID conferencing, which we are doing till today. But this was all part of change initially, but then we had series of losses. Look at these pictures. This girl, she is tired. She doesn't want to do anything else beyond this point. This boy, maybe he has no friends, no school, no going out, parents busy working online. Many people known to us have lost jobs, which means there are financial pressures adding on, and many people like them, they can't really see when it is going to normalize. So all of these are different kind of losses. Today we know from one survey that in last 1 year people became more lonelier, and the range goes 181%. And there is another pandemic coming, which is of grief. So let's start and understand these basic concepts, and I'm very aware that it's a mixed group of doctors plus non-doctors, so I'll be as basic as possible. So what is loss? We define loss as the fact or the process of losing something or someone important to us. It could be end of education, losing friends due to relocation. It could be end of relationship, job loss, as I said, or as serious as death of a loved one. And I know all of us have experienced somebody or the other dying who is known to us. What happened in COVID additionally was there was a lonely hospitalization and people were dying, and their final rites were also done in isolation. So, what's grief? Grief is a response to actual or threatened loss of a person, thing, or a place to which we are emotionally attached. We grieve because we are biologically willed to attach. And therefore, when we lose something or someone precious, there is this sense of sorrow, burden, and heaviness. What is bereavement? Bereavement is a state where we are unhappy because we have lost someone close to us. And we are going through that experience of losing someone close to us. Normally, what happens is after the death of a person, culturally in our society, we have certain rituals according to our uh, either you are a Hindu or a Muslim or a Christian. They have some set rules or they follow certain rituals after the death of a person. What happened because of COVID is all that this process of mourning, which we call it as the process of realizing and coming to terms with this loss, was not happening as it should happen traditionally. And therefore, it added to the problem of having this grief, which is not normal. We are more than 1 year living in this era of having COVID around us, and there is no relief, particularly now. We are seeing these kind of pictures all the time on television. We are seeing, reading all of this. These are my in-laws. Even in the house, we are not allowing anyone to come and meet them because they are very old. Even the maid comes, they are sitting in a corner like this because they are afraid that they may catch corona. They have not met their daughters in last 1.5 years, and they are just being comforted by being on a video call with them. More or less, it's the situation of many elderly people now. They have also lost few friends because of corona. And there is this weight. You can see in her eyes, she can't really see her future, near future, to go out and meet anyone. It's such a loneliness, as I mentioned. So, when we are talking about grief, I cannot go ahead without mentioning Elizabeth Kubler-Ross, who was a Swiss American psychiatrist and author of a book called On Death and Dying. She is the one who first stated 5 stages of grief. And I'll start with this quote by her. It is difficult to accept death in this society because it is unfamiliar. In spite of the fact that it happens all the time, we never see it. And particularly इंडिया में हम लोग बोलते हैं कि हम डेथ एक्सेप्टिंग सोसाइटी है, फिर भी हमें हमेशा ऐसे लगता था कि ये दूसरों के घर में होती है. What has changed because of corona is it is happening all around. Every day when we get up, we hear the news of somebody contracting corona, somebody getting hospitalized, somebody being very serious, and somebody dying. So I'll not go into the details of these stages, but just for our information, 5 stages described by Elizabeth are anger, depression, bargaining, acceptance, denial, and isolation. It's important to know that it doesn't go exactly into this fashion. लोग हमेशा ये stages में जाते हैं, किसी को नज़दीक कोई डेथ हो जाता है तो they go into these stages, not exactly in a linear fashion, and they can go from one stage to other stage, they can keep moving from one stage to other stage till they come to new normal. So in my limited experience of dealing with people during this corona times, there were various emotional responses. Like the first thing I realized, last April my friend from US called me and she said her father-in-law was alone in Mumbai. He was in the house, not going out. Neighbors were only helping him get the things from outside. And still, he had cough for 2 days and fever. Considering his age, neighbors only admitted him to the nearby hospital. And then he was shifted to some facility which she was not aware of because he became corona positive, COVID positive. She is there with her husband, the only son. They have no way of communicating with her father in law because he didn't have mobile or anything. He was there in one hospital of which they just knew the name, they didn't know the doctor, they didn't know whom to contact. They called the hospital multiple times, but they couldn't connect with her father in law. With great difficulty, I could locate the doctor and I could send him messages on his mobile, to which he replied very late in the night. He understood the problem and he said every day he will communicate to me about the health of my friend's father in law. This person was in ICU for 12 days. Luckily, and I was talking to my friend and her husband, whatever I gather information from this treating doctor. On day 10th or 11th, I spoke to my friend and I told her that it's night. You can call the hospital, you can connect to ICU in charge doctor, and maybe you can request him to go to your father in law's bed and show him on a video call. She was finding it really tough because I think उनको ऐसे लगा कि डॉक्टर कैसे ये करेंगे. Finally, she gathered the courage and she told the doctor. Doctor did a great job of going to this patient, putting them on video call, and they could at least see him. Though he was serious and gasping and not doing very well, they could see him, and next day he died. My friend and her husband, they were angry, they were guilty, and they were sad later on. They are still not come out of it. And there are stories, many like this. There was anger of other patients and families because there was no oxygen recently. All the hospitals were full. There was no remdesivir, no ventilatory beds. And people were panicking, they were angry. Some families, all of them, they were positive, so they had to request somebody else to work, run around on their behalf. They were anxious. I know of a family where 3 of them were home quarantined and in 3 different rooms, and one young boy called me and said, Auntie, are we all going to die? And how will I know my parents are okay? They were talking to them, but he was not sure whether parents were telling him that they are okay. I'm just trying to tell you the extent of the suffering each and every one of them went through. And there were some physical responses, like, once they are out of corona, they were just fatigued and slow and lethargic. They were not able to sleep because they had just gone to a place in the hospital where they saw everyone dying. Nobody was coming, nobody was helping. Their only solace was doctors and nurses who were coming and talking to them, but they couldn't even see who they were because they were in this PPE kits. Of late, I spoke to two patients of mine, cancer patients. They lost somebody very close to them, younger than them, due to corona. And in last 1 year, they are not able to adhere to their regular chemotherapy regime, and their disease has progressed. They were scared to go to the hospital. They preferred to be at home in pain rather than going to the hospital where there were many patients due to COVID. There were few occasions where I was asked for reasons of their loss. Somebody known to me, they lost two family members 3 days apart. Parents and two children all came positive. One child and a father passed away. Mother is still in the hospital. And the boy who's surviving is asking, why am I living to see all this? You know, one girl, she's in her 40s, not married. She already had some psychiatric problem, and she's completely gone from bad to worse. And I worry about her because there is no support system available for her right now. So how did I support to those who I could? It's just a personal experience. If you look here, some people called me at this stage when they said, अभी 2 दिन से बुखार है, अभी मैं क्या करूं? Then they got admitted. When they got admitted, there were no oxygen, and one of my friend, he said, I have a factory and I have oxygen cylinders in my factory. Should I get them to this small nursing home, and can they fit it and give oxygen to all the patients? You know, who would talk to treating doctor who are super busy managing patients despite all the challenges? Then my role was is to communicate with the doctors, arrange for uh, all those 5 6 patients who were on the oxygen, and help them get through that situation, and again talking to some friends and getting them shifted to bigger hospitals. You know, on a personal level, during COVID last year, me and few of my friends, we helped elderly in our community, in our society, where maids were not coming with food tiffins. We kind of guided them when they should do the tests and when they should go for admission. I have, with my husband, personally helped few uh, senior people, take them for vaccination both the times and bring them back, taking their appointments and making sure that they get their certificates. Some people were not getting medicines, hospital beds, and to help them with that and communicating back to their children abroad was another task because they were anxious there. They were not allowed to come. There's one uncle staying here who lost his wife, and both the children are abroad. It's 1 year now, but they couldn't come. So he is staying alone. My job is to drop into his house at least once in a week and see if he is doing okay and convey it back to his children. Sometimes there was a death without medical assistance. There were few incidences, and then the tragedy which I saw in the family, they had money, they had everything, but they couldn't save the patients. You know, extending the help to be ready to be there with them even for their emotional needs was something I could help them in a very limited way, and it still continues. At a community level, we have seen great examples of things where family members couldn't go for funerals. Others, doctors, medical staff has done that. I have very briefly associated with this organization, and I think one of the person from this organization is present here, Chintan. You can connect with him later on, or you can write it, but they are doing phenomenal work from just starting a website and giving this ready-made information and connecting and networking. I'm briefly associated with them for helping them with medical needs, medical questions. If somebody needs urgent help, then to network and see that they get it at the earliest. But there is lot what we can do. And why we should talk about all this, we know that these are the things which are happening around, but why it is important that we should talk about it? Because what we are going through as a community or an individual has long term psychosomatic effects. There could be incidences you must have seen where there is a suicidal attempt because they can't any longer take it. There could be permanent change in the behavior because of the impact of these deaths, because they were not expected deaths. Somebody dying because of prolonged illness, and somebody dying who was 10 days back was okay and no more after 10-12 days is unbelievable. It's a stage where people can't get out of that shock in a routine way, and there is this disruption of important relationships one after the other. I can't go into the details of these different types of grief, but you must know that if particularly you don't have good relationship with your parents or children, you don't have good coping skills and there is no social support, then your reactions to such type of grief are dysfunctional. We might find many people who are going through this dysfunctional grief, or we may define them to be having one after certain period, but we need to be aware, and as a community we need to work on this. That's something called disenfranchised grief, where people cannot openly acknowledge or publicly mourn, particularly when the relationship is not recognized or respected and griever is not respected. दे हमारे कम्युनिटी में अगर किसी भी नाते को नाम नहीं दिया जाता, तो अगर इसमें कोई दोनों में से एक चला जाता है तो it's a grief which is called disenfranchised grief for that griever. And there is whole lot of complicated grief and traumatic grief where deaths are sudden. Maybe children are dying and parents have to see it. Multiple losses. One news I saw that two twins died few hours apart in Hyderabad or some city. You can imagine what those parents must be going through. And these are the impact. We know that targeted psychotherapy, psychoeducation is the ideal way. Sometimes antidepressants may help. We as a community, what we can do is, our job is to build this resilience towards getting these people to a new normal level. If you can see here, the journey beyond is not easy, and there will be a life which is totally different than this life, and we, all of us, with our skills, whatever we have, we try to help them to reach up to that new normal level. We are not going to get over this grief easily, but we can at least support each other the way we live with it. I think I'll stop here just by putting this quote of Elizabeth Kubler-Ross. She's saying the same thing, that we all will go through this, but you will heal and you will rebuild yourself around that loss you have suffered. You will be the whole again, but you will never be the same. So we have to understand that the pandemic which we are going through is going to change all of us forever, but we have to be having this resilience to bounce back. And I think the next speaker will talk more about this, but I will end this by giving this little bit of information. I've recently published this book called Touching Hearts Gently. You might find some information, some guidance in those stories which I have written about my personal experiences with patients, of terminally ill patients dying, and the way their families cope with it. Thank you.
Thank you very much, Dr. Kulkarni ji. Actually, as you rightly said towards the end, that what we picked up is particularly the two words, the grief, and then also the resilience. That's where our next speaker will be enlightening us. She's Gracie Andrew. Uh, she will be able to mix Hindi and English, like as Dr. Kulkarni has tried her best. And she doesn't need much of introduction. When you talk about mental health, India में mental health का काम किसी का है, और top लोगों में से Gracie stands at one of the top, and she has given lectures and talks in many places, including United Nations. और जो उनका काम है संगत से, especially the word stands as संगत, and her close association with Sangat and the work she has carried on while she was associated with Sangat. And then past, I believe, 7-8 years since the core stone has been established themselves in India. Unka jo kaam hai, especially the emotional resilience among children, adolescents, with a special focus on children. Unka jo kaam hai, I think we all will get benefit hearing from her experiences personally, not only from mental health point of view, from the right word, the beautiful word. What it is all needed at this hour is the resilience, how we will be able to cope, how we'll be able to build and support each other. So I herewith would like to welcome Gracie ma'am, Gracie Andrew. Please, the floor is yours. Carry on, please. Thank you.
Thank you. Can you hear me clearly? Just wanted to check.
Yes, we can hear you clearly. Thank you.
It's not easy to be the last speaker after such a interesting two talks that we heard, especially Dr. Kulkarni's very moving experiences. But I'll try my best. मैं start करूँगी एक case study से. कुछ साल पहले एक कपल आई थी मेरे क्लिनिक में 10 साल की बच्ची के साथ, और दिस चाइल्ड 10 साल की बच्ची, the parents were very upset. They were very they came to the clinic saying that this daughter of theirs used to be a very good student, बहुत अच्छे मार्क्स लेके आती थी, और बहुत उनका बिहेवियर भी बहुत अच्छा था, लेकिन कुछ महीने में बहुत शरारत करने लगी, became very naughty, was beating her younger brother, and most difficult thing was this child was running away from school. स्कूल से भाग रही थी, तो रिसेस में वो भाग रही थी और उनको ढूंढने के लिए कोई भी किसी को जाना पड़ता था, बहुत दूर नहीं जाती थी, उनको वापस लेके आते थे, और इसके लिए माँ बाप बहुत परेशान थे, उनको पता नहीं था क्या हो गया। तो हम साइकोलॉजिस्ट कभी कभी बच्चों के साथ बात स्टोरी से या कुछ टेस्ट से जो हम उनको एक्सप्रेस खेल से एक्सप्रेस करने में मदद करते हैं। और जब मैंने वो उनका असेसमेंट किया तो मुझे लगा दो चीज़ थे कि कुछ था हादसा उनके जीवन में हो गया था, और कुछ उनके फैमिली में कुछ झगड़ा हो रहा है, उसके ड्राइंग्स में, उसके स्टोरीज में मुझे लगा। तो मैंने पेरेंट्स को बुलाया, उनको पूछा कि आपके घर में कुछ हो गया होगा। तो उन्होंने बोला हाँ, कुछ महीने पहले उनका ग्रैंडफादर का डेथ हो गई और वो बहुत क्लोज थी ग्रैंडफादर से। और दूसरी बात है, तो मैंने बोला लेकिन घर में कुछ झगड़ा हो रहा है क्योंकि मुझे लगता है कुछ उनको डिस्टर्ब कर रहे हैं। तो उन्होंने बोला कि पहले वो बहुत हेजिटेट होते बोलने में, लेकिन बाद में उन्होंने बोला कि हमारे बीच बहुत झगड़ा हो रहा है, इस डेथ के बाद कुछ प्रॉब्लम्स आ रहे हैं फाइनेंशियल और कुछ, और हम दोनों शाम को बहुत झगड़ा हो रहा है घर में। और एक बार हमने देखा कि वो लड़की बाहर थी, दरवाजे के बाहर सुन रही थी। तो मैंने उनको बोला कि यही हो सकता है, ये दो चीज है उनको डिस्टर्ब कर रही है। ये केस स्टडी मैंने आप लोगों के सामने लेके आए क्योंकि समझने के लिए कि बच्चे डेथ या ग्रीफ को, उनके एक्सपीरियंस बहुत अलग होते हैं। वो लोग बच्चे एक्सप्रेस नहीं कर सकते हैं जैसे एडल्ट एक्सप्रेस करते हैं, और बच्चे नहीं बोल सकते कि हमको ऐसा हो रहा है। दूसरी बात है कि हम भी बच्चों को स्पेस कभी कभी नहीं देते हैं, हम भूल जाते हैं। हम एडल्ट्स इतना डूब जाते हैं हमारे ग्रीफ में कि हम भूल जाते हैं कि बच्चे को भी कुछ फीलिंग्स है और उनको एक्सप्रेस करना है। और एक बात, हमारे एक्सपीरियंसेस बिहार में जब हम रेजिलियंस के प्रोग्राम करते हैं स्कूल्स में, बच्चों को भावना के बारे में बात करने में उनको वोकैबुलरी भी नहीं है, क्योंकि कोई भी कभी भी उनकी भावना के बारे में पूछते नहीं और वो बोलते नहीं। तो इस सिचुएशन में क्या होता है, जब बच्चे एक्सप्रेस नहीं कर सकते तो वो इम्पैक्ट होते हैं उनके बिहेवियर पर। तो कभी कभी उनका बिहेवियर चेंज होता है, कभी कभी उनका स्टडीज में इफेक्ट होते हैं, स्टडीज नहीं कर सकते, कंसंट्रेट नहीं कर सकते, और माँ बाप सोचते क्या हो गया। कभी कभी सोमैटिक कंप्लेंट्स होते हैं, स्टमक एक, हेडेक, ये कंप्लेंट से आते हैं। तो एक इम्पॉर्टेंट चीज है जब बच्चों के साथ हमको उनके ग्रीफ में समझने में, एक है कि उनका एज का डेवलपमेंटली वी हैव टू बी अवेयर दैट चिल्ड्रन react, the way they deal with grief is different as they grow. So when a child is, say for example, if a child is around 5 years old, for a 5-year-old child, they see death as temporary. They feel that that person may come back. There is this whole feeling that they don't understand when you say heaven or you talk about afterlife. These are concepts a 5-year-old will not understand. But if a child that is older, when he's 9, that child realizes that there is some permanence to death. कि ये मेरा मम्मी या डैडी या कोई भी जिसका डेथ हो गई वो वापस नहीं आएंगे. ये permanence, death is permanent. इस concept को they start understanding at that age. But by the time a child is older, they become more realistic, and a 10-year-old or a 12-year-old will be very different. They will ask you a lot of questions. ये क्या हो गया, कैसा हो गया? They're very much bothered about अब क्या हो जाएगा, what will happen now, how will things be different. So they have a lot of questions at that age. They want to understand, so they will ask you many details. Or by the time they're older, like when it's an adolescent, then there's this whole recognition hota hai ki life is so fragile that that person is not going to come back. And this is the time when they get into substance abuse or suicidal ideation is very, very common among the adolescents, when they realize that this, when they come across death. So it is very important to understand the developmental level of the child, first of all, to understand how he's experiencing grief. Now, how do you deal, or what do you do One is it's very important to be honest. कभी कभी हम भी adults हम डर जाते हैं, डेथ से हम सब लोग डर जाते हैं, fear is in every all of us, और इसके बारे में बात करने में भी हमको डर लगता है. हमको लगता है कि बच्चे के साथ क्या कैसे करेंगे, क्या बोलेंगे उनको. अगर किसी को चाइल्ड को बोलना है कि उनका किसी का डेथ हो गया, उनका क्लोज रिलेटिव या उनका मदर और फादर का डेथ हो गया, तो हम बहुत हेल्पलेस होते हैं. हम लोग कैसे बोलेंगे उनको. लेकिन इम्पॉर्टेंट है हाँ हमारे फीलिंग्स को भी एक्नॉलेज करना और उनसे थोड़ा ऑनेस्ट होना कि कुछ फॉल्स प्रॉमिसेस नहीं करना कि ये नहीं हो गया या आप वो दूर गई है. कभी कभी हम बोलते हैं ना आपकी मम्मी दूर गई है, तो ऐसे झूठ बोलना अच्छा नहीं है. वन इज ऑनेस्टी. द सेकंड थिंग इज सेफ्टी. उनको दे नीड दिस फीलिंग ऑफ सेफ्टी कि are they safe, what will happen to them, what is going to happen in the future. To be honest, to talk about their safety, to be able to give them that reassurance. And depending on the developmental age, you can give it by giving a lot of love, giving a lot of affection, making them feel that there is a future, that they'll be taken care of, giving them some space, and basically listening, helping them to talk. हम बच्चों को कभी स्पेस नहीं देते हैं कि आप बात करो, क्या हो गया, आपको क्या लगता है. Because for children there are three aspects of grief that they need to understand. One is the emotional, कि emotions उनके अंदर, what are the feelings, so letting them express those feelings is important. Second is spiritual, especially in here spirituality is very important. How do we handle it spiritually and for them to be involved. And third is intellectually, they need to also understand what is death, and you can explain it in simple ways depending on their age. कि बच्चों को पता है, उन्होंने टीवी पर देखा है, they have seen death, they have seen their pets dying. You can discuss it and explain in terms of trees and leaves and the nature. So nature is the best way to explain to children about death and making them accept it. And that is something we need to talk to children right from the beginning. We should make them aware of it even in schools. When we're talking about emotions, we should not hesitate to talk to them about death so that they understand and they're prepared. What happens in our society, we don't talk about it. So the children are not aware of this experience. Now, in all this, imagine the situation in COVID. I have very limited experience of working in this period on death and grieving. I worked during the tsunami, but not at this point. But imagine the situation where we don't have rituals sometimes. They're not able to see the body. There's no, the multiple deaths in the family, like you just heard. In all this, you can imagine how traumatized the child would be, or the adolescent, or the young person would be. So considering even in normal times when there's death and grieving, it is a journey. Grief is a journey. Bereavement is a journey, and it is no two people experience the same. Kabhi bachche, you may feel that the child is not even responding. Sometimes parents have come to me and said, my child, sometimes he's just playing and laughing. He doesn't seem to have got affected. And sometimes he acts very naughty. But the child some children take time to process the death. It's not that they will process it at once. So sometimes they will be okay and sometimes they'll be affected. So you have to be ready to accept, give the child or the adolescent space to talk. Listening is very important. Letting them talk about it, discuss the situation, discuss your own grief or what you are feeling. These aspects are very, very important when we talk to children about them. And finally, I know it's quite late, so there's a lot I can talk about children and adolescents and grief. But I'd like to also say that I think in the future, as we work in schools and we're talking about emotions, we talk about emotional resilience. We teach children about managing difficult emotions. I hope that we can also bring these aspects much wider, like, aspects of the COVID, what children are experiencing, what they see, how they feel. And I'm hoping that, through these kind of events and these kind of efforts by organizations, communities can become aware of grief, the journey that children face developmentally, how different kids feel, experience it, and how do they behave and what do they do, and finally, what do we do as adults? How do we deal with them? How do we help them? So with that, I kind of stop here. I'm ready for any questions. I know I've not kind of gone, I could have spoken more, but I am just also aware of the time. Thank you.
Thank you very much, Grace ma'am. I think the mantra for this evening, especially from the children's point of view, because somebody was asking in the chat that पूछ रहे थे कि आखिर resilience को कैसे build up करना है, खासकर children में. So I think you answered even before being asked that the three mantra, the emotional, spiritual, intellectual, जो holistic development जब बात करते हैं हम बच्चों का, जो global development, I think, from emotional resilience point of view, especially during these difficult times, unprecedented times, आपने इतना अच्छा उसको, phrase किया है. I know those three elements itself is probably we can write books and books on them. But the way you have summed it up, that how to pay that attention to the children, I think I'm sure the participants would have, gathered that so that not only they're helping their own children, but also the children in the community and in their society. So once again, thank you very much for all, Dr. Troyer, Dr. Priyadarshini, and Gracie Andrew, ma'am. Dr. Vikasji, shall we open up for the session for the question and answers? I'm keeping an eye on the chat box as well. So if you don't mind to any
Absolutely.
questions.
I think I'll request all the participants, if you have any questions or if you want to share something or if you want to need some clarification on any topic, you can ask. Please feel free to type in chat box. But before we have some questions, I have a question for the panelists. That, ma'am, that actually at this time we have all around in Bihar and nationwide we are having grief. People are dying and we are losing friends. What are the few things people should do within the family to support, or in our community to support family and friends? Because we see that they suddenly withdraw and suddenly they have a sense of loss and they don't want to interact, and of course we understand we have to provide them time. So what are the few things from your experience we should be doing with either with the family, how we can help them because they are part of this is the question
Would
for the
Dr.
panelists,
Kulkarni
but
or
I
Dr.
think
Yeah?
Sure. Should I go?
Yes, please, Doctor.
Okay. So basically अगर आपको ज़्यादा जानकारी नहीं है कि ये कैसे डील करना है, I think first thing is when you understand that there is a panic, you should call for help. You should connect them to right people. You can't yourself handle this situation when you're not trained to handle such situations. So I think first thing is to identify what you can take on and what you cannot. Like if अगर उनको सिंपल इश्यूज है जो घर में 3-4 लोग बीमार है एक साथ, उनका खाने का प्रॉब्लम है, मेडिसिन लाने का प्रॉब्लम है, डॉक्टर से बात करने का प्रॉब्लम है, तो आप ये कर सकते हो. ब्लड देने का प्रॉब्लम है, प्लाज्मा का प्रॉब्लम है, यू कैन नेटवर्क एंड गेट देम कनेक्टेड टू. बट अगर इमोशनली उनको हेल्प चाहिए, सपोर्ट चाहिए, तो आई थिंक इट इज़ इम्पॉर्टेंट दैट यू कनेक्ट देम टू प्रोफेशनल काउंसलर्स, और मे बी समटाइम्स देर इज़ अ नीड टू कनेक्ट टू साइकियाट्रिस्ट. You need to know who are these people who are ready to help and who have time to spend with these people. Normally the appointments are taken, but maybe you have some doctor friends, you can help them connecting it with them. We have done it few times, and I think that's the way you can help them reach up to right help. Maybe others can add, I don't know.
Dr. Shekhar, can I have another follow-up question with the panelist? Because this is very
Yeah,
important.
yeah. Please go ahead. And,
So, as you know, ma'am, that in in India we have a sort of psychiatrists and counselor and therapist, and considering this is a pandemic and people are losing everyone, everyone in and around people are losing life. So, what should be your strategy to develop such kind of human resource within the state? I understand that connecting with the psychiatric and the expert in that domain is important, but where we don't have expert, we don't have medical profession, and we don't have such people, what should be the state should be doing? How we can build up those human resources who can immediately and provide support to these families.
Again, in my limited knowledge and scope of all this issue, it is impossible to be able to handle all the needs of the patients at this particular time. I think, but simple things like we do have counselors in the hospitals. If we can have, like I saw one person speaking about from a government point of view, and they have certain schemes. If there is a way to empower these already existing counselors or medical social workers to handle these issues, I'm not very sure whether that is possible in a government machinery or government systems. Even in private hospitals today, uh, there are these people which are available. They have fairly good training. Unfortunately, there are not many palliative care and end of life care specialists or the palliative care workers who can work hand in hand with them. So uh, I think we have to begin from there. That's best I can think of.
I'd like
thank
to
you.
add is bringing in some of our experiences when the tsunami happened in Tamil Nadu. One is to create awareness about grief, about the process, what happens. Because I'll give you an example. When we went into the communities, we found families who had lost many, many members. So, for example, with a lady who lost her kids, and the other families or the community would try to hide all the photos and hide everything. And they believe that if she sees the picture, she'll feel bad or she'll get depressed, or so we should not remind her of anything. So we really had to spend some time educating them, within the context, so within the cultural context, without kind of uh, they have the same rituals, but trying to explain that it is okay for her to grieve. She needs to be able to see those pictures, talk about it, talk about the good times that she had with her kids. So there are certain steps that can be done in terms of creating awareness in the communities, among community workers, about grief, about what people go through, so that when they encounter people, they can also be, they can kind of say the right things, or they don't say things like "stop crying, everything will be better," which we often do. Why don't cry? Be strong. Be strong is a very common thing to say, which it's not possible sometimes when you're grieving. So to be able to say the right things, to be empathetic, and be able to kind of make people feel that you're listening to them. Simple things can be taught, can be kind of can make them aware, and that way at least we can reach out. And as Dr. Kulkarni said, yes, some people need, there could be support that they can get from peers, but some people need help like counseling, or they need psychiatric help. So these community workers could kind of know when people need that kind of help and help them to get that. So that is something that one can do in the community level. That was, yeah.
Thank you, Grace, ma'am. Actually, I'm wondering, just carrying on. I know you wanted to touch the youth and adolescents, which is another core area you do work as cornerstone. There is a question, if you don't mind, just briefly mentioning how to build resilience among youths experiencing stress, and other hand, losing every single livelihood opportunity. Would you like to shed a quick light on that, please?
So when we talk about building resilience, it's a resilience is a set of skills that you teach people, whatever adversity they face, whether it's a loss of job. So when we teach children, it's resilience is not rocket science. It's very simple skills that you teach young people and children on how things like how do you recognize your emotions, how do you deal with difficult emotions, how do you recognize your strengths, how do you use those assets and resources that you have within you, how do you set your goals, how do you plan, how do you problem solve. So we teach these things in our schools to kids in small groups, and they then help each other to learn these. So these are simple skills that one teaches. And it doesn't matter what the adversity, it could be a loss of job, it could be livelihoods. And I'm not saying that these structural issues that happen are not, like they're big issues that everybody faces. But when we're talking about building resilience, it's only just helping them to look at it from a strength, from their own resources and strengths, and to be able to pull out those assets and deal with the situation. So that's what it means. So that's what you do with youth. So if possible, if there are youth that have getting youth together and teaching them together, these kind of skills would help them to deal with whatever adversity they face. I hope
Thank you,
that's
ma'am. Thank you. One question for Dr. Troyer, which is an interesting one. And it's not about putting you straight on the spot, Dr. Troyer, but it's the question is that, is it really necessary to isolate those who have died due to COVID-19 from their family? Because it is causing great anguish, which we know. Is it avoidable? Because what is the evidence actually, any parts of the world that infection being transmitted from the dead? Would you like to, that is one question which I think everybody is curious, what is the evidence there that what sort of transmission, especially from our loved and dead ones?
Excellent question. The answer, so to the question, is it necessary to separate the dead body from the family because of contagion? In my professional opinion, the answer is no. And I'll explain why the answer is no. There, very early on in the pandemic, there were studies about transmission of the coronavirus from a deceased individual by pathologists and anatomists, particularly in the EU. And what they found was that with standard practices involving PPE or other just standard precautionary measures, there was very minimal, if any, transmission risk of the coronavirus from the dead. The risk of transmission of the virus has always been with the mourners or the family members at the funeral. And so we have had situations in which families came together for the funeral and spread the virus amongst themselves, but it wasn't from the deceased person. So to the question, now there's a history here very quickly, and I won't go on about this, but there is a history here where a similar thing happened in the AIDS epidemic, in which if you died from AIDS, families were not allowed or were told not to touch the deceased because of the virus. Now that was completely untrue. There was no medical rationale for that. However, as with disease and contagion and pandemics, there is a tendency, and I'm going to work more on this, to automatically assume a dead body caused by a pandemic is contagious somehow, outside of any kind of medical research on this. So I've seen what the questioner is asking about in photos and testimonies from family members in India, and I felt terrible about it, because there isn't really a public health medical reason that has been presented yet that demonstrates a significant risk of infection from the deceased. And I think that is we'll get more about this in the future, but as of right now, there's not a huge reason to do it. I've not seen anything that way.
Thank you. This could be the last question, very pertinent one,
Okay.
and it is going to challenge us.
Dr. Shekhar
Oh,
ji, can you give an answer for this question in Hindi? This is very important. Dead body से कभी भी किसी तरीके का infection नहीं हो सकता है. And this is against the protocol issued by Government of India. This is very important. Sneezing and coughing is the way the virus is spread. जो dead है, dead body से कहाँ sneezing and coughing हो? The very important component कि you have to follow the protocols जो family member उनके साथ हैं, उनके साथ के लिए. And जैसे ही आप बाहर हैं, यदि घर में नहीं है, बाहर हैं, तो वो वायरस की जो डेंसिटी है वैसे ही कम हो जाती है. तो ये आप यदि थोड़ा सा सोशल डिस्टेंसिंग कर, जो फिजिकल डिस्टेंसिंग है और प्रोटोकॉल बना के रखते हैं, तो वो किसी तरीके का हार्मफुल नहीं है. नहीं लोगों का मिलना आपस में वो ज्यादा खतरनाक है, रादर देन कि कि आप वहां पे इस तरीके के कारण से नहीं जा रहे हैं कि डेड बॉडी से कहीं वायरस जो है सो ट्रांसमिट नहीं हो जाए. थैंक यू, बट आई एम सॉरी मैंने इंटरप्ट किया है, because this is a very important question.
Absolutely. As Dr. Troy said, it's a very, very important question. Thanks Barunji for asking, and thanks Dr. Troy and Ajit ji. थोड़ा हिंदी में भी उसको आप संक्षिप्त में बोल दिए. Actually, एक challenge है, because the question itself is coming from the local institution who actually run the institution and the home for special children, deaf, dumb, and blind especially. And Sateshji is asking that how can we rebuild the needs for special children and their parents in coronavirus period. The word I use, the challenge, is a real challenge, especially when it comes to this particular group of children. So I don't know. I'm going to open this through all three speakers, whoever wanted to pick it up and then wanted to put it, that it is about how can we rebuild. That's whether it is a resilience or strength or confidence, especially in the special children and their parents in these difficult times, in the COVID times. Thank you. Who wanted to go ahead, please?
I have very limited experience working with special children, but I think situations like this and otherwise also, we probably will have to navigate through whatever is available in and around us and finding the solutions on the go. I don't know, maybe Gracie, you can add to it.
It is a very challenging question, but I will give an example of I don't know whether it's answering, but a very personal experience that we are facing is I have my sister-in-law is mentally challenged. She's older. She's not a child, but she doesn't live with me, but she lives in another city with my husband and her sister, and she is very, very scared. She watches the news and she's extremely anxious about the COVID-19. So experiencing all the things that other children experience: fear, loneliness, not being able to have people visit her, not being able to go out, and therefore there's a lot more difficulty. The difficulty is not only faced by her but the caregivers around her. And how do you take care of her? How do you make her feel better? How do you kind of make her understand about the situation, about the lockdowns, about and how do you find ways? So in fact, so what I'm trying to say is that dealing with children with special needs, if there are other issues like poverty or other issues that are there, then that's a difference. But dealing with children with disabilities in terms of how do they deal with grief and issues that are coming up because of COVID, it's very similar to how you deal with other children. It's just that you have to find ways to communicate. You have to find ways in which you can communicate at their level and find solutions around to make them, deal with or cope with it. So it is the same skills of resilience, but you have to find the communication channels. So I don't know if that answers your question.
Thank you very much, Gracie. I herewith would like to actually come to the concluding remarks, which I would like to hand over to Vijay sir in a minute. Once again, looking at the time, it was supposed to be almost, I think, half an hour, but that also shows the importance and also our interest and participant interest, although we lost quite a few by this time. Just for your information, Dr. Troy, it's almost 10 to 11 at night at the site. So once thanking all the speakers and all the participants, the comments and the questions, what we would like to say is that if you have any burning questions, because we know as a group that we opened can of worms. हमने ऐसा कुछ कीड़ा को छोड़ दिए हैं आपके मन से, and it is not everyone's possibility to keep all them back into the can. आपका कुछ questions है, bubbling है, हम हमारा नंबर और email ID drop करने जा रहे हैं chat box में. Please email either via WhatsApp, and we will make sure वो सब questions को collate करके speakers को भेजेंगे. And as they come along, the responses we would be very happy to share. क्योंकि हम ऐसा इसको छोड़ना नहीं चाहते हैं कि बहुत ही sensitive subject है और इसका follow up भी होना चाहिए और कुछ लोग personally भी affect होंगे, not only professionally, and that would be our utmost sincerity and the responsibility I personally on behalf of all the speakers feel. तो पूछते रहिए, and in a minute मैं phone number or email ID mention करने जा रहा हूँ. So thanking all the speakers once again, may I request Vijay sir to come with the concluding remarks, please?
Shekhar, sir, just a minute, sir. Before getting into your final concluding remark, I would like to just hear a few words from Mr. Ajit Singh on, because he works with Ministry of Health, and then he might have some insight that how we can develop some sort of human resource, where we don't have such. If you can give us some few, your thoughts that how the state can build up on human resource considering the grief and these process, that would be beneficial for all of us.
Absolutely.
Thank you very much, Dr. Vikas. Actually, I want to ask this question. What you are asking. To the panelists, how the other countries are actually providing support to public healthcare system, this is particularly for the grief counseling. Because in the country like India or the state like Bihar, basically our counselors are engaged in reproductive health and nutrition counseling, not for this kind of counseling. Even it is not a priority for the state or even the country. Only the state like Kerala, they are providing the palliative care. They have initiated some activities or program for the palliative care. But the state like Bihar, we have not even thought of. So it's my suggestion how we are going to create a pressure on the government to initiate this kind of institution in the state. And the second one, how to prioritize funding, government funding this sector, particularly for the mental health. This is a very, very important issue. And this is the one, I think, suggestion.
Sir, can I answer this?
Yeah, please.
Yeah, so just wanted to let you know that in this in Patna There are three institutions, AIMS Patna, IGIMS Patna, and Mahavir Cancer Institute Patna, where all three places palliative care training has been given through AIMS Delhi, and there is an organization from Singapore. And I was personally the mentor for all three centers. Dr. Badani, who is head of AIMS Patna, is here in this group, and I think it's an opportunity for us with your presence to start some basic work with three institutions and people who are trained there to start some preliminary work there. Maybe Dr. Badani sir, would you like to add on something? I'm not very sure.
Yeah.
Thank you, Dr. Kulkarni, for giving me an opportunity to say something. Actually, since last 1.5 years, I'm trying to start some palliative care things. We are doing today also. We got 3-4 patients and many phone calls for palliative care from different part of Bihar. But from government side, I was trying, and I went there 2-3 times and had some meeting with the health secretary also. But somehow due to this COVID, the things become delayed. Once this will come down, we can again go and start something for and I will ask Mr. Vijay also to help me and other persons. And AIMS Patna, IGIMS and Mahavir Cancer Sansthan, all three institutions are doing palliative care, and morphine is also available in all three places. Thank you very much for giving me opportunity to say something. We are there to do something whatever we can, and I will like to meet and talk with other people who are today from Bihar and who can help in going ahead.
Yeah,
thank you,
Dr. Vadani. Actually, just are you planning to initiate community-based intervention for palliative care? Is any program or anything what you are thinking?
It is in our program. Presently, we have got 18 beds of palliative care ward with us, and OPD we are running every day. But it is in the plan. But and our director has also agreed to go ahead with that. So yes, ultimately we have to go to the home.
Yeah, great. Thank you very much. So okay, fine. I'll take your mobile number and I'll discuss with you, and we'll just prepare a proposal on palliative care, even the community-based intervention and facility-based intervention simultaneously. And I'm trying to facilitate how to put all the proposal in state PIP, and I'll facilitate even at the national level to approve this kind of activities in the state. Thank you very much. This is really great.
And we're getting, actually my number is given in Tata Memorial Hospital palliative care also. So every day 2 or 3 patients for TMH is also being referred to me for the palliative care in Bihar. So that way also we are helping on phone and providing morphine, and if possible admitting them and going ahead with the whatever way we can help. So in a whole week we are getting 6 patients every week.
Thank you very much. Actually, just for the information, actually palliative care and mental health is one of the program in comprehensive public health care initiatives by the government of India. This is the part of the Ayushman Bharat. There are the 12 package program, and palliative care and mental health is one of them. So this is the part of the intervention, and we required kind of the professional, those who can prepare a wonderful proposal and submit to government. Thank you, sir. Thank you very much.
Thank you. We will like to meet you also and go ahead with all the things. It's nice to be with this thing.
Sure.
Sir. Okay.
So Vikas, go ahead. Sir ko bula lijiye. Thank you.
Thank you, Ajit ji. So I think we will have some additional session with Dr. Badani and Ajit Singh and other people who are involved with State Health Society and Department of Health at state and the national level. So now I would like to invite Vijay Prakash sir to just give her his thoughts and concluding remark for the sessions. Thank you, sir. Over to you.
Thank you, Vikas. Let me thank you. It was a very, very illuminating session. And let me thank you, all the speakers. They spoke so well. And the very fact that we have continued about 45 minutes ahead of they extended the program by 45 minutes speaks a lot about the interest people have. मैं 3 बातें चाहता हूं कि आज इसको पिन पॉइंट किया जाए. नंबर 1, हॉस्पिटल के लेवल पर हमें क्या करना है. अभी पैलिएटिव केयर की बात हुई. हॉस्पिटल के लेवल पर काउंसलिंग भी करने की जरूरत है प्रॉपर्ली. कैसे हम लोग जो, क्योंकि सबसे पहला इंटरैक्शन डेथ का हॉस्पिटल के लेवल पर हो रहा है. जो होम में हो रहा है वो तो अलग है, लेकिन जो हॉस्पिटल के लेवल पर हो रहा है उसको जरा सा देखने की जरूरत होगी हमको. और एक जो बहुत बड़ी बात आज कही, जो इन्होंने प्रोफेसर टॉयड ने, कि ये जो डेड बॉडी है, डेड बॉडी से परिवार को हटाने की आवश्यकता नहीं है, क्योंकि डेड बॉडी से कंटामिनेशन नहीं, मतलब इन्फेक्शन फैलता नहीं है. ये वैसे भी नहीं फैलता, वैसे भी ये फैलता है खांसी से, ये इससे, लेकिन नेजल डिस्चार्ज वगैरह से होता है कि नहीं होता है, इसको थोड़ा सा ठीक से एग्जामिन करा लिया जाए. अगर प्रोटोकॉल में बदलना है तो इसको बदलें. ये ग्रीफ को कंटेन करने में, बेरीवमेंट को मैनेज करने में बहुत बड़ा रोल अदा करता है. जिस समय आदमी रोता है अपने स्वजनों के से मिल करके, वो शायद सभी तरह के इसको हटाता है. इमोशनल मैनेजमेंट के लिए बहुत बड़ा काम करता है. रोना एक बड़ी क्रिया है और लोगों से मिलना, इसलिए लोग अमेरिका से यहाँ आते हैं डेड बॉडी से देखने के लिए, और उनके पैर को पकड़ने के लिए, उनके पैर को रोने के लिए, छूने के लिए. मैं समझता हूँ शायद इस बात को हम लोग समझें. और अगर ये संभव है, अगर जो बात कर रहे हैं तो मैं समझता हूँ आपसे, आई वुड लाइक टू रिक्वेस्ट यू, इफ यू कैन गिव अस मटेरियल्स, we should talk to government of India. Ajit ji हमारे मदद कर सकते हैं, and all the doctors who are here, if we can probably convince them that this is not necessary, तो ये बहुत बड़ा काम होगा हम लोगों का grief और bereavement management के लिए. So this is at the level of hospital and dead body. दूसरी चीज जो कि मैं समझता हूँ शायद इम्पोर्टेंट है, वो है कि स्कूल में कैसे मैनेज होगा. अभी ग्रेसी ने बहुत अच्छा बताया, पुस्तक में जो डॉक्टर ग्रेसी ने, कि किस तरह से बच्चों को मैनेज करने की जरूरत है, फैमिली में ही मैनेज करने की जरूरत है, और मैं समझता हूँ स्कूल में ही मैनेज करना. इसमें टीचर्स ओरिएंटेशन एक मेजर रोल प्ले कर सकता है. तो हम लोग को टीचर्स ओरिएंटेशन पर काम करना चाहिए. एंड दिस इज पॉसिबल कि अभी तो वैसे टीचर्स बहुत ज्यादा अवेलेबल नहीं है, लेकिन टीचर्स की भूमिका बड़ी इंपॉर्टेंट होगी. और तीसरा है कि हमको होम के लेवल पर मैनेज करने की जरूरत है. और होम में मैं समझता हूं कि हमारे जो ट्रेडिशनल सिस्टम्स हैं, ग्रीफ मैनेजमेंट के, बेरीवमेंट मैनेजमेंट के, कल्चरल जो ट्रेडिशंस हैं, कल्चरल ट्रेडिशंस का बहुत बड़ा स्ट्रेंथ है. मैं समझता हूं कल्चरल ट्रेडिशंस को फॉलो करने के लिए अभी दिक्कत क्या हो रही है कि हम लॉकडाउन के लेवल पर या अदरवाइज हम लोग नहीं कर पा रहे हैं. मैं समझता हूं उसके लिए भी हम लोगों को कैसे हम लोग मैनेज करें, इस पर हम लोग को चर्चा करनी चाहिए कि घर में हम लोग कैसे उन कल्चरल प्रैक्टिसेस को मैनेज कराएं, क्योंकि वो बनी हुई है इसी के लिए. तो आज इसी संदर्भ में हम लोग प्लान कर सकते हैं. हम लोग इसमें सिविल सोसाइटी की एक बड़ी भूमिका होगी, जो कि सिविल सोसाइटीज को भी हम लोग को इसमें ओरिएंट करने की आवश्यकता है, जो कि इसमें मदद कर सकते हैं और ग्रीफ और बेरीवमेंट को मैनेज करने में या लॉस को मैनेज करने में हमारी मदद कर सकते हैं. मैं आप सबों को बहुत बहुत आभार व्यक्त करता हूं, सभी स्पीकर्स को. बहुत ही अच्छा आज का सेशन रहा, और विकास को, अजीत जी को, और एम्स के प्रोफेसर आए थे उमेश भदानी जी, डीन वहां के, और जितने भी लोग आए थे, मैं सभी प्रबुद्ध जनों को बहुत बहुत आभार व्यक्त करता हूं. और आशा करता हूं कि हम लोग फिर इसी तरह से अभी और इस मुद्दे को छोड़े नहीं. ये मुद्दा ऐसा है जिस पर चर्चा नहीं हो रही है. हम लोग और चीजों पर चर्चा कर रहे हैं, लेकिन इस तरह के मुद्दों पर चर्चा नहीं कर रहे हैं. इस पर हम लोग और भी चर्चा करें और प्रयास करें कि हम लोग एक समाज में एक बेहतर चीजें बना सकें. क्योंकि मैंने और चीजें हम लोगों ने चर्चा की थी कि इसका फॉलोआउट क्या होता है, सरकार की क्या योजनाएं हैं. मैं समझता हूँ उसको भी हम लोग को समाज तक ले जाने की जरूरत होगी. आप सबों का बहुत बहुत आभार, और मैं आशा करता हूं कि हम लोग ये चीज कंटिन्यू रखेंगे. बहुत बहुत धन्यवाद.
Thank you, sir. Thank you very much, sir.
Thank you once again, everyone. We have mentioned the email ID and the phone number. So please send your any questions you would like to, or anything you might have affected with this sensitive subject, which we have been discussing quite late tonight. So किसी का आपका questions है तो जरूर हमको भेज दीजिए. और सेशन एंड करने से पहले हमने लगभग आधा participants बचे हैं. एंड एक्चुअली विकास जी ने बोला था कि जो शादाब जी गुजर गए थे, ही इज एक्चुअली फ्रॉम अरेरिया बिहार, एंड he did his PhD in sociology from University of Edinburgh, where Dr. Vikas also, I believe, comes from. What I know of Dr. Vikas ji just for the past 4 weeks. Dr. Troyer, he's the doctor you mentioned you lost. Actually, he belongs to one of the district called Araria, which is kind of border to Nepal in Bihar. So knowingly or unknowingly, what you put is everybody grieves who is involved in this discussion. So if everybody excuses, shall we pay respects to our beloved friend whom some of us know and don't know? So I think this is where we would be able to show our loss and our respect to our colleague. So I would like to start now for 1 minute silence, please. Thank you. Thank you, सभी को बहुत बहुत धन्यवाद. Many thanks for paying that respect to Shadab ji, and we hope his family will find the strength to come up with the loss they are experiencing themselves while we are discussing this subject. This is the start of the process. So once again, thanking everybody. Let's be in touch and see how we can build on it. We're glad that already 1 or 2 thoughts and ideas have come up. So how we can proceed further, maybe learn from other states and other parts of the world, and come up with some best good practices models, especially for Bihar and beyond. So once again, thank you very much for everybody coming together and staying this late, and wish you a good night and happy evening for you, Dr. Troyer, and especially the other parts of the world people have joined. Thank you very much once again. Bye-bye.
Thank you very much, Shekhar ji.
Thank you.
Thanks.
Personally, I want to thank Shekhar
Thank
for
you,
the
Ajit.
wonderful moderation,
Thank
and
you.
Dr. Vikas for facilitating this session and organizing the wonderful discussion. Thank you.
Thank you,
Thank
Ajit.
you.
Thank
Thank
you,
you,
Dr.
sir.
Thank you, Vijay sir. Thank you.
Thank you, Gracie ma'am, for coming and joining us after a long time. Yeah, thanks. Thank you, sir.
Thank you, Vikas ji.
Thanks.
Thank you.
Yeah, thanks. Bye, everyone. Have a good night.
Bye-bye.
Bye.